All right, so today we're diving into something that might hit a little close to home for some of you.
Oh, yeah.
We're talking about what happens when you lose a tooth.
Hmm.
So picture this, you're biting into a nice crisp apple, and instead of that satisfying crunch, you feel,
Yeah.
well, a gap where a tooth used to be.
Oof. I can imagine.
Yeah, not the best feeling, right? But you know what is a good feeling?
What's that?
Being prepared. And that's exactly why we're here today. We're going to explore all those options you have for replacing a missing tooth so that when life throws you that curveball,
Yeah,
you're ready to handle it.
absolutely. And, I think sometimes we tend to think that if a problem isn't really bothering us at this very moment,
Right.
we can just kind of sweep it under the rug and ignore it. But when it comes to missing teeth, that can really backfire.
Oh, really? So you're saying that even if it doesn't seem like a big deal right now,
Hmm.
putting on getting that tooth replaced can actually cause even bigger problems later on.
Exactly. And it might seem counterintuitive, but delaying treatment could actually end up costing you way more in the long run.
Huh. That's interesting. You'd think putting it off would save you money, but it sounds like you're saying the opposite is true.
It really is. And the main reason for that has to do with your jawbone.
Hmm.
You see, when you have a missing tooth,
Mm-hmm.
the jawbone underneath it isn't getting the stimulation it needs from chewing.
Okay.
It's kind of like, let's think about soil erosion.
Okay.
If you don't have plants there to hold the soil in place, it starts to wear away,
Right.
right?
Right.
Well, it's similar with your jawbone. Without that tooth root, the bone in that area starts to shrink.
So it's not just about the empty space where the tooth used to be.
Nope.
It's about the foundation underneath it starting to disappear.
Exactly. And as that bone shrinks, it can actually cause the alignment of your other teeth to change.
Oh, wow.
They can actually start to drift out of place, tilting towards that gap.
I see.
And that can throw off your bite, make it harder to chew properly,
Oh, no.
and even increase your risk of gum disease.
Wow. So we're talking potential pain problems, chewing, and even gum disease, all because of one little gap.
It's true, and it's like a domino effect. One thing leads to another. And if you wait too long to deal with that missing tooth, you might end up needing even more complicated and expensive treatments down the line.
Like what?
Well, for example, you might need a bone graft to rebuild that lost bone structure before you can even think about getting a replacement tooth.
Okay, I'm getting the message loud and clear. Procrastination is not our friend when it comes to teeth.
Nope, not at all.
So let's say we're smart about this and we want to take care of that missing tooth right away. What are our options?
Well, the good news is you have several options. The most common ones, and the ones we'll be focusing on today, are dental implants, dental bridges, and removable partial dentures.
Okay.
And each of those has its own pros and cons. So it's all about figuring out what's going to be the best fit for you.
Let's start with dental implants. I've heard those called the gold standard, but they also seem a little intimidating. What's the deal with them?
So dental implants are basically artificial tooth roots. They're usually made of titanium,
Okay.
and they're surgically placed into your jawbone, and over time they actually fuse with the bone, becoming like a permanent part of your mouth.
Wow.
Then an abutment is attached to the implant, and that acts as the connector for the crown.
The crown is the part that actually looks and feels like a tooth.
Yep, exactly. And because the implants are integrated into your jawbone, they're incredibly stable.
Mm-hmm.
They function a lot like your natural teeth, so you can bite and chew with confidence.
That's great. I know implants also have a reputation for being a bit pricey, though.
That's true. They typically do have the highest upfront cost. It can range anywhere from a couple $1,000s to over $8,000 per tooth.
Wow.
And that's because you're paying for the materials, the surgical procedure, and the expertise of the dentist or oral surgeon.
Okay, I can see why people might hesitate at that price, but if they really can last a lifetime, like some people say, it seems like it might balance out over time.
That's a really great point. And the longevity of implants is definitely a major factor to consider. The American Academy of Implant Dentistry reports that dental implants have a success rate of over 95% over a 10-year period.
95%? That's amazing.
It really is. And in many cases, with proper care, implants can actually last a lifetime. So they can be a very cost-effective solution in the long run, especially compared to options that need to be replaced multiple times.
Okay, that makes sense. I'm starting to understand why implants are so appealing even with that initial cost. But I'm guessing they're not right for everyone.
Right, you're exactly right. They do require sufficient bone density for that implant to fuse properly.
I see.
So if you've already had significant bone loss in your jaw,
Yeah,
you might need a bone graft before you can get an implant, or your dentist might recommend a different option altogether.
that makes sense. So what about our second option, dental bridges? What are we talking about there?
So think of a bridge, literally bridging a gap.
Okay.
In this case, it's a prosthetic tooth that gets anchored to the natural teeth on either side of that gap.
So those natural teeth kind of act like pillars holding the bridge in place.
Exactly. And to make that work, those supporting teeth do have to be prepped a little bit.
Okay.
A small amount of enamel is removed to make space for crowns. And those crowns then cover the supporting teeth, and they're attached to the prosthetic tooth, forming the bridge structure.
Got it. So it is a bit more invasive than just getting a single implant, but I guess less invasive than needing multiple implants to replace several missing teeth.
You got it. It's a good option for people who are missing one or a few teeth in a row,
Mm-hmm.
especially if the teeth around the gap are healthy and strong enough to support the bridge.
Okay. How do they compare to implants in terms of cost and durability?
Bridges are typically less expensive than implants, usually costing between $1,000 and $5,000.
Okay.
They're not quite as durable as implants, but with good care, they can last for a solid 10 to 15 years.
All right. So they're a good middle ground, it seems, between implants and the third option, which was what again?
Removable partial dentures. And those are probably what most people think of when they hear the word dentures,
Right.
although they're not the same as full dentures.
Right. These are just for replacing a few teeth, not a whole arch.
Exactly. They consist of one or more prosthetic teeth that are attached to a gum-colored base, and they're designed to be removed and put back in as needed.
Mm-hmm.
Usually they either clip onto your natural teeth or they use some dental adhesive to stay in place.
So kind of like a puzzle piece you can pop in and out.
That's a good way to think about it, and because they are removable, they do require a slightly different approach to care and cleaning.
Makes sense. So it seems like they'd be a good option for people looking for something a little more affordable and less invasive. But I'm guessing there are some trade-offs with those too.
Absolutely. While removable partial dentures can be a great option for some people, they definitely have their own set of pros and cons.
Okay.
We'll get into those next, and then we can really start to compare all three of these options side by side.
That sounds great.
Yeah.
All right, so we've got our lineup here, implants, bridges, and those removable partial dentures.
Right.
Seems like each one has its own, pros and cons.
Yeah.
But how do we actually go about deciding which one is the right fit for us? Is it really as simple as just, picking our favorite?
I wish it were that simple.
Yeah.
But there's a lot more to consider, and, of course, cost is always a big factor for people.
Yeah, for sure.
But I really think it's important for us to shift our mindset from just thinking about cost to thinking about cost effectiveness.
Okay, what do you mean by that?
Well, sometimes what might seem like the cheapest option up front could actually end up costing you more in the long run.
Yeah, I can see how that could happen. Can you give me an example?
Sure. Let's think about removable partial dentures for a minute.
Okay.
Those often have the lowest initial cost, which can be very tempting.
Right.
But because they're removable, they tend to wear down more quickly than implants or bridges.
Oh, I see.
So you might end up needing adjustments or even replacements more often.
So it's kind of like buying a cheaper appliance that, you'll have to replace sooner rather than getting a higher quality one that lasts longer.
That's a great way to put it. And with dentures, you also have to factor in the cost of things like cleaning solution and adhesives.
Oh, yeah, that's true.
And all those little expenses can really add up over time.
So you're saying it's not just about the initial price tag, but the total cost of ownership, I guess.
Exactly. And that's where dental implants can actually be a really good investment.
Oh, okay. How so?
Well, yes, they do have that higher upfront cost,
Yeah.
but they are designed to be incredibly durable. Remember that 95% success rate over 10 years we talked about?
Yeah, that was impressive.
A lot of implants actually last for decades, even a lifetime, with proper care.
So if you were to divide that initial cost over, 20 or 30 years,
Right.
it might actually end up being more cost effective than having to replace dentures or a bridge multiple times.
Exactly. And you're also getting the benefit of a replacement tooth that really feels and functions almost exactly like your natural tooth,
Right.
which can make a huge difference in your everyday life. Being able to eat the foods you enjoy, speaking clearly, and just feeling confident when you smile.
It sounds like you're a pretty big fan of implants.
I am. I really am. But I do want to make it clear that they aren't a perfect solution for every single person.
Right.
Like we mentioned before, they do require you to have enough bone density.
Yeah.
So if you've experienced a lot of bone loss, you might need a bone graft first, which adds to the cost and complexity.
Right. So it's not one size fits all.
Not at all.
It's about finding the option that best suits your individual needs and situation.
And that's where your dentist's expertise comes in.
Okay.
They can evaluate your oral health talk with you about your goals and your budget and really help you figure out the best path forward.
So let's say I'm sitting in the dentist chair and I'm trying to decide between all these options.
Okay.
What are some of the key questions I should be asking?
Well, the first thing I would say is be upfront about your budget. Don't be shy about talking about cost and payment plan options. Your dentist wants to help you find something that works for you financially.
Okay, good advice.
It's also really important to ask about the longevity of each option.
Yeah, how long is this thing going to last me?
Exactly. How long can you realistically expect it to last? and what might be the potential costs for maintenance and repairs down the road.
These are good questions. It's so easy to get caught up in the here and now, but thinking long term is important.
It really is. You should also feel comfortable asking your dentist about the pros and cons of each option as it relates to you specifically.
Okay.
For example, if you grind your teeth, your dentist might recommend against a certain type of bridge or denture material because it's more prone to wear and tear.
I see. So it's about getting personalized advice, not just generic information.
Exactly. Your dentist is your partner in this process. The more open and honest you are with them about your concerns and priorities, the better they can guide you toward the solution that's best for you.
So it's not just about the science, it's about that human connection and finding a dentist you trust.
That's such an important point.
Yeah, and speaking of advocating for yourself, one thing that really jumped out at me in the article was the importance of insurance.
Right.
How can our listeners figure out that whole side of things?
That's a great question, and insurance can definitely be a bit tricky. The first thing I'd recommend is taking a look at your insurance policy and seeing what kind of coverage you have for different tooth replacement options.
Okay.
Some plans might cover part of the cost for implants, bridges, or dentures,
Mm,
while others might have certain limitations or exclusions.
right.
So don't hesitate to call your insurance provider directly and ask them about your specific coverage.
It's amazing how many people have benefits they don't even know about.
It's true. You'd be surprised.
Always worth making that call.
Absolutely. And if you're considering a more expensive option like implants,
Okay.
a lot of dental offices offer payment plans or financing to make it more manageable.
That's really good to know. It's all about, removing those barriers and making sure people can access the care they need.
That's right. And remember, investing in your oral health is really an investment in your overall well-being.
Mm-hmm.
A healthy smile can really boost your confidence, improve your self-esteem, and even contribute to better health overall.
I love that perspective. It's not just about fixing a gap. It's about taking care of yourself.
Exactly. And speaking of taking care of ourselves, the article we're stressing mentioned that implants can last a lifetime.
Right.
And it got me thinking about other areas in our lives where we choose to prioritize those long-term benefits over the maybe more immediate costs.
Yeah, that's interesting. What comes to mind for you? Well, right away I thought about preventative health care.
Oh, that's a good one.
It's so easy to put off those annual checkups or screenings, especially when you're feeling fine.
Right.
But those are really investments in your health that can prevent much bigger problems down the line.
Absolutely. And it applies to so many things.
Yeah.
Investing in your education, building strong, healthy relationships, even taking the time to cook nutritious meals at home.
Mm-hmm.
Sometimes those upfront efforts might feel like a hassle, but the payoff over time is huge.
It's like that old saying, an ounce of prevention is worth a pound of cure.
Exactly. And just like with those preventative health checkups, early intervention and dental care can often save you from more extensive and costly procedures later on.
It's really interesting when you think about it. We're kind of making these cost-benefit analogies all the time in life.
We really are, yeah. It's everywhere.
And I feel like, sometimes when you take a step back and look at the big picture, the initial hurdle doesn't feel quite so big.
Yeah, that makes sense. I think you've hit on a really important point there.
It's about shifting our perspective a bit, right?
It's not just about how much something costs right now, but what's the value we're going to get from it over time.
Exactly. Whether we're talking about our health, our education, our teeth even, it's those investments in ourselves that often have the biggest payoff in the long run.
I completely agree.
So for our listeners out there who might be dealing with a missing tooth right now,
Yeah.
what's the one thing you really want them to take away from this whole conversation?
I think the most important thing is don't let fear or uncertainty hold you back from doing something about it. Replacing a missing tooth isn't just about getting your smile back. It's about protecting your overall oral health and well-being.
Right.
And there are options out there. There really are.
Yeah.
With a little research and a good conversation with your dentist, you can definitely find the right solution for you and your budget.
That's such great advice. Knowledge really is power in these situations.
It really is.
And, even though we've been talking specifically about missing teeth,
Yeah.
I feel like we've stumbled upon some pretty valuable insights about decision-making in general.
I agree with that. It's all about thinking long-term, considering the value, and not being afraid to invest in ourselves.
And those investments, whether it's our health, our education, or even our smiles,
Right.
they often pay off in ways we never could have imagined.
Exactly.
So for everyone listening out there, if you're dealing with a missing tooth, don't panic.
Yeah.
Do your research, talk to your dentist, and remember, you got this.
And who knows, maybe this will inspire you to take a look at other areas of your life where that long-term thinking can really make a difference.
That's a great point. Well, that about wraps it up for this deep dive. Thanks for joining us, everyone. Until next time, keep exploring, keep learning, and keep those smiles shining bright.